Hello, everybody. This is Dr. Mychal Beebe with Arete Chiropractic, and we are doing a collaborative business series. And our guest today is Dr. Nicole Schertell with Vibrant Health Naturopathic Medical Centers. Say hello, Dr. Schertell.
Hello.
So we at Arete Chiropractic and Vibrant Health refer patients back and forth frequently, and we wanted to just have a conversation today, introduce our businesses a bit, talk about the patients that we see together, and then talk about what we're doing in our offices to keep people safe these days during the COVID pandemic and what our vision is for the Seacoast as we start to come out of this health crisis. So, Dr. Nicole, why don't you go ahead and share a little bit about yourself and what got you into naturopathic medicine?
Thank you, Dr. Beebe. It's nice to be on your show. Just me. um, so we are, I work with two other practitioners. I'm a naturopathic doctor, and I work with another naturopathic doctor, Johanna Moss, and Elise Greenfield, who's a nurse practitioner. And what got me into naturopathic medicine is I was in a U.S. healthcare management and policy course at UNH, and I got enlightened about the shortcomings of our healthcare system and how influential insurance companies could be on the type of care we receive, what treatments we get, and I got inspired to be able to help people in a different way where I felt like I was filling in the gaps in our healthcare system that weren't being met. Alternatives to help patients address their health conditions without suppressive medications, without all the side effects, and really getting to the root cause of things for people. How about you, Dr. Beebe?
Yeah, I just love what you said, where you're getting to the root cause, and especially now where COVID is affecting people who have comorbidities. It is so important to help boost our health naturally and understand that health comes from the inside out. And I know that I've referred a bunch of people over for things like IV vitamin C and some of the other supplements that we can do to help support our immune systems and open up the immune pathways in the body. And it's just so vital to help bodies heal from the inside out. And that's really what got me into chiropractic as well. So I am an upper cervical chiropractor, which means a little bit different. We start working on the spine from the top down and really focus on the cranial cervical junction. So where the head and neck meet, which is the most neurologically sensitive area in the body. And what got me into that is understanding how vital that area was and how much that upper neck influenced the entire spine all the way up and down. Because when that upper neck is misaligned, the eyes don't sit level with the ground, and then the rest of the body will compensate. And so if we can get that head and neck relationship properly aligned, the rest of the spine comes into alignment underneath, and a lot of symptoms lower down start to recover and heal. And so I was just inspired to help people live in a gravity environment, standing evenly on each of their legs. So it minimizes the wear and tear of their joints, and it helps their nervous system work better so the brain can talk to the body can talk back to the brain. And again, it's one of those finding out the root causes of a lot of problems. So a lot of like reasons why people would see us are head and neck injuries, whiplash, concussion, mild traumatic brain injury, numbness and tingling down an arm. And when we bring a patient in, it's an initial evaluation to see if we can help. And then they get to meet us and they get to decide if they want us to. And then we take them through the exam, we see what's going on. And if there is a misalignment in the upper neck that's contributing to their main problems, like headaches, numbness and tingling, neck pain, then we take some pictures, because you really never want somebody to put a force into the upper neck without seeing exactly what's going on with the bony anatomy. So we take some very specific 3D imaging, and then we lay out a treatment plan for them, which looks a lot like a physical therapy program, a couple times a week at first, dropping down to once a week, and then we reevaluate in about 6 to 8 weeks. So that's really what we do in our office and why I was inspired to be an upper cervical chiropractor. Now, because we refer a lot of patients back and forth, go ahead and share a little bit about what kind of patients you traditionally see and what it looks like for you to have patients in your office.
So we see a lot of people who've been to multiple doctors, multiple specialists, and no one can figure out what's going on with them. I'm sure you see those people too.
Yeah.
And since I'm a naturopathic doctor, we have had training in assessing the spine. And I'm so grateful that, like, when I am looking for the root cause, that I can tell oftentimes that, you know, if a patient has a structural issue, that could be getting in the way of them responding to other treatments that I'm trying with them, that I can send them to you to address that part. So it's neat how, like, you know, I'm not going to try to fix the spinal problem. I would refer to you for that. But I'm happy that I have the training to be able to assess the patient and include that in my evaluation as a potential cause. It's a real thing. So I definitely feel like what you do complements what we do so well. So many people do have structural abnormalities or injuries that they just haven't corrected from, that have to be addressed in order for their nervous system to work and respond to the other treatments that I'm using. So that's kind of neat. And then we see patients that are told, like, how you feel right now on your medication is all that I have to offer you. And, you know, their symptoms aren't fully managed and the patient is still suffering. So we see those types of patients. We see patients that don't like the options that they've been given. They've looked into the risks themselves. They don't feel comfortable. And so they're seeking an alternative, because most of the time they're not given the alternatives. They're given the medication or the surgery, and this is your only choice, when many times, as I've found, because I've been in practice for 11 years, it's not the case. So people come to us seeking alternatives for all types of conditions. Like, we see GI issues, irritable bowel syndrome is a huge one. We see a lot of tick-borne illness because of where we live. So we do specialize in that. We treat a lot of endocrine disorders and thyroid disorders where patients are on thyroid medication, but they still don't feel like their metabolism is working or that they have their energy back. People with hair loss, unexplained, fatigue, so many different things. So our specialty is really in our approach more so than the conditions. We treat a lot of different conditions. Autoimmunity, even though there are so many different autoimmune diseases, the approach is very similar because we're trying to work with an immune system that's inappropriately acting. And we have great naturopathic approach that works with diet. And it's very similar, even though it's a different autoimmune disease, the approach is very similar with many of those autoimmune conditions. So yeah, we get the tough to treat cases. We get very complicated cases, but I enjoy it. I really do.
Yeah, I have seen some of your cases, and one of the ones that's springing to mind is a young gentleman who had tick-borne illness, Lyme, with some complications of babesia, which affects the head and the brain. And he was having chronic fatigue, a lot of gastrointestinal issues, and chronic headaches. And he'd been working with you for a while. Headaches were still persistent. And he had made massive strides with some of his gastrointestinal issues, his energy issues. I mean, he just couldn't say enough about how your treatment changed his life, when, you know, he was being told by a lot of other offices and physicians that he was going to have to just kind of live with the pain that he was in. And, you know, then once you had shifted a lot of his gut and fatigue issues and gotten the Lyme infection under control, we took care of the upper cervical misalignment, which helped reduce a lot of the headaches and some of the dizziness and kind of motion sickness that he was still experiencing. And, you know, now when he couldn't before go on a jet ski or on a boat, now he can go on a jet ski and a boat, and now he can eat more regular foods, and it's made massive impact in his life. And that was, I mean, that's just a really great example of what you work with and what we work with and how they come together.
Very complimentary.
Yeah.
Like, a lot of people are told, unfortunately, that whatever they feel, if their doctor doesn't understand what's causing it, that they should see a psychiatrist, or it's all in their head, you know. Or we see also people that are nervous about going to the doctor because they are afraid they're going to walk out with 5 prescriptions.
Yeah.
So, yeah, so I think you and I both can really fill in that gap in healthcare in a non-invasive, very supportive way.
I completely agree. And, because of course, COVID-19 is on everybody's mind these days, why don't you go ahead and just share with us a little bit about how your business is handling that to keep people safe, and then what your vision is for the Seacoast community as we come out of this.
So we've been fortunate in that we did do some telemedicine prior to COVID. We have patients that are local, but we also have a lot of patients that live like within a couple hours because our specialty is so unique. So for some of those patients, we've done telemedicine before, but there has been almost like a 98%, 95% shift over to telemedicine in our office. We have been accepting new patients still through our HIPAA secure. It's a video software that allows a patient to see us face to face so we can establish care if they're in New Hampshire, and phone appointments for established patients. So that's been really helpful because we've still been able to move forward. And right now, people need to be healthier more than ever. So there are a lot of people that this has made them realize, maybe before my blood pressure wasn't that much of a risk because I was on medication. And so that mitigated that risk. But now that you have COVID and having hypertension or being on blood pressure medications makes them more at risk for having more of a life-threatening consequence from COVID, it has brought to light that, okay, we need to be more than just managing the disease with medication. We need to really, start to think about our health a little bit differently, that it's not just the absence of disease, it's more of a state of balance and optimal health in the body. And so I'm hoping that from all of this, that people will seek out naturopathic medicine more to maybe find diet and lifestyle and supplemental ways to lose weight and get off the blood pressure medication if it's appropriate. I can prescribe blood pressure medications and natural treatments, so I'm able to help patients safely taper off when it's appropriate. And, we always look at the risk in the individual case with every patient. But yeah, I mean, those are things that I'm hoping people will, if they have prediabetes, want to get that reversed with us so that they're at less risk if this comes back around again.
Yeah, I mean, that is just so beautiful what you said, where health is not just the absence of disease, right? But health is going to be restoring your body to optimal function. And I really hope that that's where people's minds are starting to shift and go to as we understand the consequences of dealing with a novel or new virus. With chiropractic, unfortunately, telemedicine isn't an option. So, we haven't learned how to do the remote adjusting of the spine yet. So our practice is taking a lot of in-office measures where we are still open. So chiropractic as an essential business, just like naturopathic medicine, it helps keep people out of hospitals. It helps manage chronic diseases. So through this pandemic, we have been open. We are still taking new patients. I know that you'd referred in a patient of yours who was also in a car accident. So once you cleaned the glass out of the cuts and abrasions in his head, because he put his head through the windshield, he sent him over to us, and we got the spine starting to be corrected from a pretty significant trauma. And that kept him out of an emergency department, which is crucial at this point. And so in our office, we are having people, if they're an at-risk population, or they take care of a loved one who is at risk, they make a special populations appointment, which we're reducing the number of people in the office so that they have a minimal risk or exposure. If they are not in an at-risk population and they still want to minimize their risk, then they can wait in their car and then be called directly into our office when it's time for them to be seen. And then after upper cervical care, a lot of times people will recover for a period of time to allow the adjustment to integrate and work in their body better. So they can, instead of, we have a recovery room, some people call it the nap room. So rather than recovering in the office, they can head to their car and recover in their car as well. We are wiping down all high touch surfaces and beds in between every single patient visit. Patients can request that we wear gloves to work on them. And obviously we change gloves in between patients. We have masks. So we are doing everything that we possibly can to make sure that we're minimizing risk for people. But we are still open to help people who are in crisis and or help manage people's chronic conditions. And as we come out of this, I think that we just really need to, as a society, as a Seacoast community, focus on taking care of our health in a proactive way. And you said it beautifully. It's understanding that we don't want to wait until we have these risk factors. It's just ever more vitally important to recognize that we need to do things now to make sure that these factors never develop. And if we do that, then we are going to be much more resistant to any type of problem in the future. And this is something that I call like the greening of healthcare. So over the past 10 to 20 years, there's been so much more focus on environmental factors as we realize the impact that we're having on our environment. And we're starting to take much more preventative measures to take care of our environment. And I think that this COVID pandemic has been a huge, red flashing light to say, okay, we need to start to green our healthcare, not just look for how do we treat and diagnose disease and problem, but how do we now prevent things from coming up and work on optimal function of a body. And I think that your practice as a naturopathic doctor, my practice as a chiropractor, are two fundamental things that people can do to help their bodies work better naturally.
I totally agree. And I think right now, one thing that makes me sad is that people are feeling helpless. They are feeling disempowered. There's censoring happening of anything alternative. And granted, some of it could be dangerous if someone didn't follow, proper hygienic measures and felt immune to it. I mean, there's always some risk, even with vaccines, there's still going to be some risk of, just like with the flu, there's a percentage of people that get vaccinated that still get the flu. So I think that there are things that we can do to feel somewhat in control or empowered as far as our ability to go back out into the world and having that risk there, because it will be there to some degree in the future. It won't go away 100% for a while. And I think that is, eating clean, getting enough sleep and rest, reducing stress. What you and I do is so individualized, and there's an art to it that it's very difficult to perform research and always show the results that we see anecdotally in practice that we've seen for, I've been in practice for 11 years. Some of these things are hard to show the science. Some we do have science on, but there's a common sense strength. There's a common sense argument here that, of course, get vitamin C, right? Because when you're sick, your body upregulates vitamin C absorption in your gut. So what you normally tolerate up to 5,000 milligrams, you might be able to tolerate more. Your body is uptaking it for a reason. The body is wise. And there are things that we can do to keep our body as strong, keep our inflammation down, and keep our system less toxic and build up our resilience so that if we did get it, maybe it's more likely to be a mild cold and not become so severe. And so my advice, I guess, would be empower yourself to feel as healthy as you can and seek out those experts in the area that can help you to have your spine aligned so the nerves can flow to your organs and get your your gut associated lymphatic tissue at its optimal place. And eat good nutrition and make sure you're getting all the vitamins and nutrients and not eating junk and sugar that's going to suppress your immune system. Be empowered in that way. So that way you feel like you have some control as we all come out of our quarantine and have to live our life again without fear.
Yeah, I love the idea that you put forward about us taking control of our health naturally and understanding that there are options out there that don't just necessarily mean we have to reach for a large medical intervention. And I think that both Vibrant Health Naturopathic Medical Center and Arete Chiropractic are foundational options for people to help take control of their health and be as preventative as possible, be as healthy as possible in a very natural, non-invasive way. And there are resources out there for people who are looking for them. Thank you. Yeah. Thank you so much for taking the time to chat with me today.
Me too. Thank you.